Welcome to the Hairloss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everybody, welcome to the first podcast of the Hairloss Show. I'm Dr. Russell Knudsen.
And I'm Dr. Vikram Jayaprakash.
Both Dr. Jayaprakash and myself specialise in the medical and surgical treatment of hair loss in Australia and New Zealand. And I've been doing it for 35 years, and Vikram?
I've been doing it for 8 years, and so I trained under yourself, and we both practice hair restoration and deal with both the medical and surgical aspects of treatment.
Now, interestingly, if you type in hair loss into the Google search engine, you'll get over 360,000 hits immediately, which tells you what a popular topic hair loss is. And unfortunately, because there are so many hits for hair loss, it's a very confusing path for people to find information that they can usefully use to sift through the myriad options that are out there in the marketplace for hair loss. And there's a reason for this. When I started managing hair loss in 1982, there were no medical treatments that worked for the commonest causes of hair loss, which were male pattern balding in men and female pattern hair loss in women. There was nothing. And in that vacuum, where doctors could not treat, swooped in a number of businesses with products making all sorts of claims about how they could influence hair loss and regrow hair. And the claims, some of them were quite outlandish, some of them were more modest. But if you look today on the internet, you'll find literally thousands of offers of different treatments out there making all sorts of claims. And a tip for the general public is if there's 1,000 treatments out there, most of them don't work. So really what we seek to do for you today and over the next series of podcasts is to try and demystify, give you some basic information about hair and hair loss, so help you navigate this difficult task of finding some credible information and credible advice. The bottom line that we want you to take away from this is that hair loss is often a medical situation or a medical problem, and therefore a good starting point is to go to a doctor who has experience in treating hair loss in men and women. That is the most clear indication we can give you of simplifying your search for a way forward.
I think that's a very good point. I mean, there's a lot of information, and you and I sort of experience that on a day-to-day basis when we consult with people. A lot of people have said, "Oh, look, I've done all this research," and in that conversation, it comes out, well, there's a lot of sort of fundamental errors of information that people have, and all the information that we're going to talk about over this entire series is all available out there. But what I found, and I'm sure you've experienced the same thing, is that there's no real one place where people can get the clear, concise information which is not sort of tainted by someone's sort of, trying to sell you a product or a service.
So as Doctor said, we're not going to offer you a product. We're not telling you to buy something here. We're trying to give you information so you can educate yourself and make decisions based on a certain level of core knowledge. So to do so with our first episode today, we thought we'd like to explain to you what hair loss is and what hair biology really means. So when patients come to talk to us about hair loss, they often are talking about hairs that they find in their comb or on the shower recess on the pillow. And that actually is hair shedding. And most people do not understand the significance or the normality of hair shedding. So let's just start with a little bit about that, and then Dr. Vikram will talk you through the growth cycle of hair follicles. So hair shedding means hair has finished growing, it detaches from the skin and it falls out. And the thing to understand about it is that every hair on your head has to do this at some stage. And the cycle length the doctor will talk about determines the shedding rate. And there's other things that can influence it. So it can change in the different seasons. Traveling overseas can have an impact on it. Fevers, childbirth, drug therapies. There's any number of things, including acute stress, that can change shedding rates. But shedding is not hair loss. So just as a little teaser, first thing to understand is that the normal range between people of daily shedding is between 50 to 100 hairs per day, which most people find hard to believe, but the mathematics shows that to be true.
Yeah, no, absolutely. It's an interesting concept, because that's what a lot of people come in and say, oh, look, I go to bed and I wake up and look at all the hairs on my pillow. And so it's, and you have to decipher that from what actually is hair shedding and hair loss. And so the thing we have to understand is that we all have hairs on our head, and they all go through a cycle. They all sort of grow, and they grow to a certain length. And that length is predetermined on a variety of different factors. Genetics is one, and one that we can't control. But if we just let the hair grow, it will grow to a certain length, and at one point it will come to the end of its cycle and fall out. And then there's a slight sort of latent period in which the next hair gets ready to grow, and then comes through again, and then that will start growing. Thankfully, not all the hairs on our body or scalp follow that exact same cycle, meaning that we don't lose all the hairs, we don't shed all the hairs on our head overnight. So various different hairs will fall out at various different rates and at different times of the day, week, month, and year. So when a hair grows and falls out and another hair grows back in its place, that is not hair loss, that's hair shedding. That's a normal phenomenon that occurs.
All right, so what is the range in humans of the hair growth phase, the one where the hair is growing, and what is the normal rate of growth for scalp hairs?
So normally what we see is it grows about 1 centimeter per month for most people on average. And there are certain variations to that. And the hair cycle for most people falls between that 3 to 5 year mark.
3 to 5 years. Right, so if you've got a long 5-year cycle,
you may grow your hair
at the centimetre per month. That means your hair will grow to 60 centimetres in best circumstances before it falls out. If you have a 3-year cycle, your hair only grows to 36 centimetres or so. So that's the difference between here and here. And we often hear patients tell us that when they were young, they could grow their hair to their waist. Now they can only grow their hair to their chest. And the difference is they're taller. Same hair length, taller body.
That's a good point. Absolutely. So, and again, and sometimes the other thing to notice is hair length can make things look even worse. What I mean by that is that if you've got a female that loses 5 hairs and they see that at the bottom of the shower, that looks a lot more obvious than if at my length of hair, 5 hairs dropped off at the bottom of the shower. So it's also the appearance of what we see that sometimes adds anxiety to the issue.
So what I said was earlier was that 50 to 100 hairs per day. So if you're the person with the 5-year cycle, maybe you're doing 50 hairs a day. If you're the people with the 3-year cycle, you're doing maybe 100 hairs a day. But when does it actually fall out? As I said, it separates from the skin and sits there until more or less something tugs it out, which is typically washing or brushing the hair. And this is what we hear a lot of the time. Doc, every time I wash my hair, hair comes out. So what I did was I stopped washing it so much, and guess what? Even more falls out. Now this is an easy trap to fall into, because if you wash your hair once a week, you're mostly going to lose a week's worth of hair. Whereas if you wash your hair once a day, you're only going to lose a day's worth of hair. So this is something that's easy to get confused about. The frequency of washing, the frequency of brushing will determine how many hairs you find. It still is the same number at the end of the week.
So that's hair shedding, all right? So what is the difference between hair shedding and hair loss?
Okay, so in a normal cycle, when the hair is finished growing 3, 4, 5 years and it falls out, an identical thickness of hair Healthy hair will replace it 3 months later and grow at the normal rate. Hair loss is when you lose either the strength of the shaft, which is the thickness of the hair, which typically happens first, or you lose the number of hairs that you have on the scalp. So we know that the number of hairs on the scalp varies between 95 and 105,000 hairs. That's normal amount of hair on the scalp. But at any one time, only 90% of them are growing and 10% of them are cycling in that in-between cycle phase. So 90% of your hairs are growing at any one time. But hair loss means less than normal numbers or less than normal quality.
That's right. And that's a really, really important point, because what I sometimes hear, and I'm sure you the same thing, people come and say, oh look, I've been losing hair and it's happening very quickly. And the reality is that people don't go bald overnight. You don't lose a hair and that doesn't come back for most causes of hair loss. I mean, there are certain exceptions to that. What we're talking about in terms of the hair loss that we're referring to is that the hair you will lose the hair and another hair grows back in its place, but that hair is a finer version of itself, a thinner version of itself, and that sequentially happens over each subsequent life cycle of that hair to the point where there's a point of no return, where it's so thin and flimsy where that version of that hair falls out and then it doesn't come back in its place.
All right, so let's talk about what the effect of age is upon hair and hair loss, because the sad truth is, ladies and gentlemen, we all lose hair over our lifetime. But it's a little bit different between men and women. So I'm going to show this to you with the first diagram on the board. So let's put this diagram up here where you've got age down here. And for the first thing, we're going to talk about the number of hairs up here, okay? So for both men and women, for the first 20, 25 years of your life, you don't lose numbers. Everything stays nice and healthy. But from about your mid-20s, for both men and women, the numbers gradually decline over life. This is an aging phenomenon. So let's plot that out here, that gradually the number of hairs goes down. Now, it could be a little bit varied between people, but it does over life go down. The interesting thing is, when you look at the shaft diameter, right, which means the thickness of the hair, so I'll put thickness here, it's different between men and women. Believe it or not, for women, between about 20 and about 40 plus years of age, the shaft diameter increases slightly, which is a function of their female hormone estrogen. So basically, even though in a woman the numbers are going down, the shaft diameter is going up until they hit their early 40s, and then unfortunately, as their hormones start to decline, so does the shaft diameter. So in this scenario, and this is normal aging we're talking about, not a medical condition. In normal aging from 40s onward, women lose both numbers a little bit and shaft diameter. And we hear this a lot with our women coming in their late 40s, their early 50s. Absolutely. And I used to have this wonderful head of hair, and look at it now. The difference with men is that there's no increase in shaft diameter because there's no estrogen stimulating it. So unfortunately for men, both the shaft diameter and the numbers decline over life from about the age of 25. So that's the difference between the sexes in terms of this. But this is normal aging hair loss. And what distinguishes it from many other types of hair loss is that it affects the whole of the scalp, not a portion of the scalp. So there are conditions that affect all of the scalp hairs, which are medical conditions, but this is just an aging condition that affects all of the hairs on the scalp, not just a specific area of the scalp.
That's great. So I think the take-home message there is that hair loss happens in both men and women, all right?
And natural part of aging.
And it's a natural part of aging. And there is a difference between hair shedding, which is a normal part of our everyday today life, and actual hair loss, which there is a process that is ongoing and that causes that. And what we're going to aim to do over this entire series is try to unpack the differences between what goes on between men and women, and then how to address those individual processes and how we can best try and stabilize things, and in some case try and get some regrowth there.
All right. So let's just stick with this for a second and say, okay, what's going to be our advice to our patients who are aging and telling us that their hair loss, their hair thinning, which really means their aging loss, is bothering them? What's our advice to them?
So look, I think the key there is to get advice from someone who is trained to deal with and manage hair loss conditions, and get a diagnosis done early, and to look at first and foremost trying to stabilize this in whichever way, shape or form, and then look at the treatment options from that. Would you agree?
Yes. I mean, you must get a diagnosis first. And basically the way to diagnose aging hair loss, as distinct from other things, is to exclude other things that could affect hair to fall out over the scalp. And we'll cover these in more detail in later podcasts, but we know that iron deficiency can have an effect. We know that the thyroid gland, if it's underactive or overactive, can affect all of the hairs on the scalp. So there are a number of things that can affect things, a number of medical conditions that can affect hair growth over time. If we can eliminate those by doing our blood tests, another reason, to seek medical advice, then what we're left with is aging. Okay, and in that scenario, we might be able to say to them, there are products, a couple of products in the marketplace that have a stimulatory effect upon hairs that would help protect against the deterioration in the shaft diameter, maybe help protect against the deterioration in the numbers over time. But there is no cure for this. So what we're really talking about is, if you're going to treat, you treat forever. There's no easy answers to this. If you're going to treat hair loss of any sort that is really a hair loss, it isn't a short-term treatment program.
Absolutely.
It is a continuing treatment program.
That's
That said,
true.
it doesn't have to be expensive. And another thing that I think we both really should emphasize to our audience today is that the cost of the product in no way reflects how effective it is.
Yeah, look, I mean, this is the thing, and I'm always astounded, is that the hair loss industry is a multi-billion-dollar industry. And I think you always used to say, I mean, if there are so many products on the market, if someone had cracked the code for hair loss, you and I would be out of a job, and all the other companies would be out of business.
That's right. If anyone comes up with a cure, we're looking for a new job.
That's right. So the problem is there are a lot of charlatans in this field, and you've got to be careful, all right? And so the goal here for us is to say, look, you as the public, listeners to this show, we want to try and give you the knowledge, the tools to educate so that you can look at these things and with a sort of a keen eye and make your own mind up on which is going to be of use. But absolutely, as you said, you're not spending an arm and a leg on you shouldn't have to spend an arm and a leg on these products.
And another reason why it is very confusing for patients is because the regulations are different when you're talking about therapies versus cosmetic products. So if you look at a cosmetic product in Australia, you don't have to prove any claims about whether you can grow hair or not. So when you see a product that says might help, may assist, right, that's not making a claim that has to be proven. So you should keep a skeptical eye about any product that advertises themselves as might help, may help. Products that make therapeutic claims will have to be specifically trialed in scientific trials. They'll have to have presented the evidence to show that it actually does have a positive effect. And there will be statistics available to you to explain to you exactly what your chances are of getting a response with those things. So just to put this in context, there are therapies that are highly regulated, and then there are cosmetical products which has a much lower regulatory base, and they can make claims without having to verify them. And that's part of the problem we have with confusion in the marketplace.
Perfect. So should we sum up?
All right, so let's summarize what we've talked about today. Effectively, we wanted to emphasize to you that hair shedding and hair loss are not the same thing. Yes, you can have increased hair shedding in hair loss conditions, but shedding is not loss. Loss means loss of quality of the shaft diameter, and it also means in worst case scenarios, loss of numbers as well. But in addition to that, every human being will end up with less hairs on the head at the end of their life than they had in their early adult life. That's a normal part of aging.
Absolutely. Now, hair loss is it affects different people differently. It's horrific for some people. So, and we're very mindful of that. So again, not to rehash the whole thing, but we will be saying this again and again. If you are experiencing hair loss, please do make sure that you seek professional advice from someone who has been trained to manage these conditions. So hair loss, hair shedding, seek advice, and that's about it.
We'll look forward to seeing you next time. We'll start to explore the topic in more detail.
Perfect. See you next episode.